I'm Leilani Eccles, and I'm here with Neuro Wellness Solutions Therapy, and I have Dr. Andrew Leone and Dr. Rebecca Scott on the call. And we are going to be talking about different therapy topics. And a big one of note lately is what the president said on Tylenol being linked to autism. And this reminds me of other comments that have been made in the past to autism and vaccinations being linked. So I just wanted to get some good old doctor opinions on this.
Well, I mean, off the bat, I think without getting into politics, I think we sort of need to look at the reality of the situation, which is look at the longstanding history that we have here, right? You know, for so long, everything in this area has said, no, that's not the case, right? I mean, because it's in the zeitgeist at the moment and everyone's sort of harping on it, it's actually caused a lot of people to go back and actually conduct research now. So if anything, I think it's having the opposite intention that they sort of had originally intended. And even now, they're already backtracking their comments, right? They're already putting out the language that says there is no strong association. There hasn't been a lot of research done. We are just kind of saying things because we can. And I think, you know, it's wrong on so many levels. But the reality is if you do a quick dive online and look at some of the research out there, you know, there is no link, right, between autism and Tylenol, right? And same thing with a lot of the vaccines, you know, and these are questions that a lot of people come into therapy with, like, what is the right thing to do? And at the end of the day, it's always, again, it's between you and your doctor, because everyone's health is subjective and it really is about them, and everyone's going to have a different whatever. If you're going through a pregnancy, different circumstances. And I think because of that, there are just so many variables that can actually explain why this is. And the reality of the situation too is there isn't a lot of research on why. What is
and Dr. Leone, you mentioned, you know, going online and finding resources. How do we know what we can trust and not trust? There's so much content out there now.
I think you're always going to be good if you go to basically scientific journals, right? I mean, I know that's not what's being preached by certain corners of the world. You know, we're calling into question scientific method, but that's the reality, that any journal of the American Medical Association or a lot of the psychological journals, these are things that have been around for a long time. They are peer reviewed, which means we're looking at them and poking holes in them. You know, these are things that have, you know, stood the test of time in terms of really being great sources of information for people. I mean, the details of it, the nitty-gritty can be a little complicated, but that's also a good thing because these things are being rigorously tested and making sure they're valid, making sure they're reliable. I'm having flashbacks of my stats class, right? And I think if you sort of do a Google search and you stick to the journals and sort of follow the patterns of thought and the consensus, right? That should be enough to really sort of tell you, right? Because if you do, like I said, a quick Google search, you're going to see lots of articles, lots of publications that all say the same thing, right? And I think that's really important. I mean, if we're seeing 15 different opinions of the same thing, okay, good. That just means we need more research to actually come to a consensus. But when it comes to this in particular, everything out there says the same thing. Right. And this isn't like butter or coffee, which every other day is good or bad for you. Like, this has been consistently disproven. Right. And if anything, I think the good thing of this scrutiny now is that people are actually going back to it and testing it. And we're actually looking into the more deeper genetic, perhaps, elements of autism and things like that. Because, I mean, look at autism in and of itself. You know, it's a giant spectrum of presentation, from a higher needs element to a lower needs, or higher functioning or lower functioning. I forget what we're allowed to say, but that's the gist of it, right? It's so huge, there's no way to really pinpoint it, right?
Well, yeah, and Dr.
The way, I think that, you know, looking at the way that conclusion was made was by crunching data to see what common elements came out, which can show us some interesting information, like, but that doesn't necessarily mean that it can be used in the way that they're using. So, I mean, the concept harking back to what you were saying, Andrew, with looking at stats, like we know that ice cream does not cause car accidents, yet the sales of ice cream spike at almost the exact same rate as car accidents. So, but these two things are not linked. These two things don't cause one another to happen. They don't have that type of relationship. But if we take a bunch of data and stick it into AI, what it pumps out may tell us that those two things line up, but it certainly doesn't say that those two things are related in the way that as a cause and effect. So, granted,
Correlation does not equal causation, right?
exactly, exactly. So it may be that there's that we see a trend of autism and Tylenol use, but we're also seeing a lot of like you're taking two things like ice cream and car accidents. Having these two things together doesn't mean one's doing the other. And I think that we have, there's too many people that didn't take Tylenol and have these different symptoms. That what is the explanation for them? So there's just too
And
much
how much,
holes.
right? I mean, it was a very empty sort of correlation, right? I mean, if they would have said, high doses of Tylenol are linked to, well, yeah, high doses of anything during pregnancy has the potential to cause harm, right? Alcohol, too much ice cream, right? Could cause a diabetic issue. It was just too general of a statement to be like any causation there. Yeah.
Right.
And Andrew and Dr. Scott, I think, you made a good point about talking to your doctor. So I know, Dr. Scott, you see a lot of patients who are autistic. What would your advice be to those patients who hear something like this? What would you tell them?
I would say look at the source and try to utilize people that are doctors. The people that we hear making these statements are not physicians. They're people that are crunching AI data. And the same goes for if you're looking online for information. If your source is from a pundit or from somebody with no letters behind their name and who hasn't done any research, then what you're getting is something that's, about the same as, your hairdresser. Your hairdresser may actually have an opinion because they hear from a lot of people and see a lot of things. But, and sometimes, and where it gets dangerous is sometimes your hairdresser's right. So how can you tell when the hairdresser's wrong or right? And the answer is she's probably an expert on that hair product and what's going to keep you looking good, but not on the nuances of genetics. So so I would say, when you're look at the source, and I think what we're seeing now is there are some individuals out there who are taking advantage, and we find ourselves even going, wait, this person's a doctor. Why can't we listen and trust them? And my answer to that is, unfortunately, that is the reality that we live in. So going that extra step to go, hold on. So if this person's an expert, what are they doing? Do they actually write, and have they done research? Are there articles that have their name on it that they did that research? Are they doing presentations? Do they work in a clinic with that population? Or are they disbarred and running a clinic and as a side hustle of sorts? Like, and we're seeing that now. We are seeing people that just, they sound really intelligent, they sound really sophisticated, and that makes them an expert. And that's just dangerous.
Well, let's
So,
be honest, sometimes they don't sound that sophisticated as well. But
Mhm.
Dr. Leon, I'm sure you love Dr. Scott's analogies as much as I do. Do you, either of you, have any other final comments?
I think, and this is, I think, reflective of a bigger issue. I think when it comes to what can people do to educate themselves, it's put on your critical lenses, right? Ask questions. The same thing Dr. Scott just did in terms of the hairdresser analogy is exactly the kind of thing these scientific journals are doing. They're scrutinizing these studies to make sure there's no undue influence and other correlations or things that could influence the outcome of the study and the validity and the reliability of the findings, right? So I think it's just, people need to learn to ask questions, to be skeptics, and to ask things from both sides and really get all the information they can. And ultimately, at the end of the day, make a decision that's best for them with the help of their doctors, people who are trained, people who have history of being
Yeah.
able to deal with this and handle it. Yeah.
I think it's, and I think that, um, just as a final note on the whole concept of Tylenol and autism is, I it's we have so many areas that are void of any type of information, that seeing what spending the amount of money and time, resources, and energy to crunch data to find a correlation that gives us nothing in terms of treatment or supporting the millions of people that are being affected by autism, both the individuals that have it and the family members and workplace environments and everywhere else that these people are trying to navigate. What we really need is research that says, how do these people function better? How can we improve the relationships? How can we improve the understanding? And how can we find out what type of earwear is going to be best for what different type of sensitivities there are? That is research that we need. That's the research that my patients need. Not
Mm-hmm.
not
Mhm.
asking me if their mom took Tylenol or not. That's not going to help them with their spouse who's saying, "Why do you sound like this every time you talk to me?"
Mhm.
So I think it's a very triggering point. It's very challenging to be a part of a conversation that quite frankly is the wrong conversation.
I think that's so beautifully said, and I agree. Well, thank you both so much, and we'll talk to you soon.